Jess was a nurse and knows the importance of keeping her body-heart healthy. But when Georgia Strong went into the hospital for issues with high blood pressure, doctors couldn't find anything wrong with her heart, but they put her on heart medications as a preventive measure. That's when she figured she needed a second opinion. That second opinion was Dr. Stephen Hotze with the Hotze Health and Wellness Center. Please welcome him along with Georgia to the show. Good morning.
Thank you, Deborah.
Has several ways of telling us something's not right. High blood pressure is one of them. There's a signal. Something's not right inside of our body.
Right. And when you go to a physician and you have high blood pressure, he tells you you've got hypertension. That's his diagnosis. But it's really a label, and you have an underlying cause of that problem. A diagnosis tells you what the cause is. So Georgia had a problem with high blood pressure, and it sent you to the emergency room, didn't it?
Yeah. What happened?
Just over the holidays, stressful time. One night, started feeling unusually tired, headache, pounding. Just knew something wasn't right.
Yeah.
My heart was
racing.
Had you
had high blood pressure issues before?
That was the crazy thing.
Or had you not checked before?
I had not checked before. I had not checked before. And anyway, I let that go on for a day or two. But I have a nursing background, and when it got, I did the little monitor at home. When it got stroke level, I decided to go to the emergency room.
Wow.
When I went to the emergency room, it took them 4 hours to get it down to where they would even transport me to the hospital. Stayed there for 2 days. They sent me home, went back in 24 hours later. It had gone back up. They gave me a medication, sent me home, and said, see a cardiologist.
Yeah, okay. So, what made you decide you need to see somebody else?
Because the cardiologist ran all the tests. I did want to be sure there was nothing wrong with my heart. That was quite an episode, and I wanted to be sure that it was not, there was not a physiological reason. There was not. All the tests were run, nothing. But the answer to the test coming out as a normal heart was to just go on 2 cardiac medications for the rest of my life.
All right,
Made
Dr.
no
Hotze,
sense.
sometimes those medications, I mean, they obviously can do some good, but the key is to start with, why is it happening anyway?
Well, that's what we like to do, is like to get at the underlying cause. And inevitably, what happens with people with high blood pressure, very commonly, they really have a problem with low magnesium. And so magnesium relaxes the blood vessels and lowers the blood pressure. But most physicians, rather than trying to find out whether that's a problem, because magnesium's so cheap, they'll just throw them on a bunch of blood pressure medication. And how did you feel on the blood pressure medication?
Well, that was one thing that I knew from, again, from nursing background, that was really going to just make the fatigue worse. That was not going to eliminate problems. It was actually going to create more.
And sometimes they have a short window. They can help get you there where you get your life together, right?
Yes.
That's the purpose of get your life together. We can help you get there. But
well, if somebody does have severe high blood pressure, the drugs will get it down.
Yes. Right.
Yes.
But why don't we get the underlying cause of the problem? So you came in, your problem just wasn't high blood pressure. What other problems did you
Well, I had the headaches and the fatigue, just the chronic fatigue. I had I just didn't have the energy to do everything that I needed to do.
You own a business. You didn't have time for
I did not have time for that.
Georgia owns Georgia Strong Realty. She's been in business for 12 years.
And
so,
it's a very demanding business.
Right.
Real estate is extremely demanding.
Well, let me just say something here. A lot of people who own a business have a busy life. A lot of people will dismiss it as, I'm fatigued because I'm busy. I have kids. I have this. I have the whole bit. And the key is when something's out of the ordinary for you, especially, you gotta look at that.
Well, it's a common symptom when people come into the Hotze Health and Wellness Center. The most common symptom we have in about 80 or 90% of the people, they feel fatigued. Now, if a person feels fatigued, that means you have low energy, right? Well, where does energy come from? It comes from your cells make energy. And if you don't make enough energy, your metabolism is going to be sluggish. You're going to have difficulty with weight. Your pressure can go up. You don't think clearly. You don't sleep well. You have joint muscle aches and pains. The whole 9 yards, depression. And you go to the doctor, and did you ask him to check your thyroid?
Yes. And I had it checked before, but
and it was
always
in the normal
fell
range,
in the
right?
normal range.
Yeah, mine was in the normal range, but there's nothing normal about what was happening with me.
So this is very common. You can have normal thyroid in your blood, the normal range, but you have to have active thyroid within your cells, and the only way you can make that diagnosis is by listening to the patient tell you the symptoms. And if they have the classical features of hypothyroidism, then they deserve a clinical trial of natural desiccated thyroid, which is what we did with Georgia. Not only that, we put her on some natural hormones as well, female hormones. But so we started you on some thyroid, and did it make any difference?
It did. I began to see a difference, and what I love is that they listen to you, and they just began to titrate the dose. They would just increase it a little bit.
And when you say titrate the dose, basically what you're doing is not saying, oh, it only comes in this much, so there you go. It's how much that person needs.
And we monitor the symptoms. So once we got you up, on a scale of 1 to 10, your energy level when you came in was a what?
2 or 3.
Yeah. And what is it today?
It's at least a 9 or 10 most days.
Yeah. And that's just putting things in balance.
And the key point to remember is that you've got to produce energy, and the thyroid hormone enables your cells to produce energy, so you're healthy. If you have high energy levels, you're going to be healthy. You're not going to have all these symptoms and problems. If you have low energy level, you're going to have a host of problems.
Yeah. All right. Dr. Hotze has written 2 books about hormones and hypothyroidism. Visit HotzehWC.com/GDH to get your free copies today. Georgia actually read this book as well, right? Okay. All you have to do is pay shipping to make your appointment, and for more information on Hotze Health and Wellness Center, call 888-473-5531, 888-473-5531, or log on to HotzeHWC.com. And everyone in our live studio audience is going home with a copy of Hypothyroidism.